Hi, What the Health Tech listeners. I'm your host this week, Justine Abson. This is the podcast where we tackle some of the trending topics, ideas and best practice in health and social care. This week, we're back with Jasmeet Rai, Associate Director at RCH Care Homes. I think we've sort of covered some of the key changes since the report was published and presented, and you've sort of mentioned a couple of times about, you know, there's so many different things that people can implement that could drive change, and one of the things is, you know, through sort of low cost, high impact kind of recommendations. Have you got any examples, or is there anything that our listeners might find kind of useful around that without kind of, if they haven't seen the report yet?
Yeah, 100%. There's quite a few. So if I take public image, for example, one of the things that we know that we struggle with is the fact that there's not a parity in how healthcare and social care is viewed. And if you think about how the media talk about the health and social care secretary, they are often referred to as the health secretary, whether that's in their news papers, whether that's on Twitter, whether that's online. It's easy to say the health secretary, but if the media don't even say something as basic as the full title, which represents a full two sectors, bear in mind that social care is actually a bigger sector than healthcare. So we employ more people, we support more people, and we should have equal parity. So one of the suggestions that was created, it was one of the campaigns that was created last year, was a and campaign. So if anyone online sees that the Health and Social Care Secretary is only referred to as the Health Secretary, they can just comment and say, and social care. So that's a quick one. But from a organisational perspective, from an individual care provider perspective, there's also various others. So one of the things that we found was that, so buddies, when you are trying to create, so from a recruitment and retention perspective, they're obviously tied together quite closely. You can't really have one without the other. And a lot of people who responded in the consultation, they said one of the quick fixes that they found when they were trying to improve retention, especially in that first 90-day period, which is such a critical period, is just making sure that you have a mentor and buddy who is assigned to your new employee either on the day or before they actually start, so they can ask someone all of the questions that they might not feel comfortable asking their line manager. There's so many others.
We can send people to we'll put a link in for the report when we put the podcast out live, because I definitely think it's something that everybody should go and have a read of if they haven't already.
And I think another one, and I'll focus on recruitment and retention at that same time, is about improving equality, diversity and inclusivity, is make sure you're using your team's experiences and your team's stories, your team's photos. Don't use stock images, number one, but also ask your team why they work in social care, why they work for your company. And some of the answers you get are really, really lovely. I mean, one of my favorite things about it, but this is from an RCH perspective rather than a people plan perspective, is when we do our staff surveys every year, we ask them, what's your favorite thing about working in social care and or RCH? And the comments that you get back, they're so heartwarming and they're so lovely, and it's all about how much they love working with their teams, or how much they love making a resident smile, and how it makes their day to make someone laugh. Social care is very much a people sector. It's all about the relationships, and I think that shines through.
I absolutely love those people stories. I think that is something that is, since we started doing the podcast in particular, has come out so much. So at the end of every podcast, we ask what the health tech moment is. And we'll obviously come on to yours a little bit later. But honestly, some of the moments that our guests have actually talked about, I mean, they've had like hosts welling up. Some of them have been really emotional. Some of them have been really funny. Yeah. Some of them have been just odd stories and things like that. But honestly, they're all such lovely, lovely stories. You know, I know there's a couple from our very, very beginning episodes. We had Big Ian on. We did a couple of episodes with him talking about dementia and kindness, and really lovely episodes. But his What the Health Tech moments at the end were just so heartwarming. especially as one around dementia. So yeah, for anyone that hasn't had a listen to that, I think it was episode 2 or 3. But yeah, and you know, I think the more we've done this and heard all those people's stories, they're just heartwarming, aren't they?
They are. They're amazing.
So Jasmeet, we've just been talking about people's stories and, you know, kind of communicating and things like that, and how heartwarming that sort of side of things can be. I think that, you know, we mentioned earlier on in the podcast about best practice, and part of this people plan is that people can share that sort of stuff with forums. I know there's a series of roundtables and things like that. So can you just tell us a little bit more about that and how that's helped with the best practice side?
Yeah, 100%. So after we launched the People Plan at the House of Lords in March, what we did was we ran 6 roundtables over the course between March to August. So the first one was just giving like an overall introduction into what the People Plan was, and it kind of covers like on a high level all the 5 topics. And then the 5 roundtables after that were focused one per month per topic. So one about public image, one about recruitment, one about retention and wellbeing, one about paying conditions, and one about training. And then what we also have is a Voices of Care forum, which is happening on the 8th of September. So if anyone wants to come and join that, we definitely would love to have as many people involved in that. And the way that we did it is that, so we had panelists that we asked to talk about the respective topics, but we also encouraged within the actual chat function, because these were online roundtables, is for everyone who is attending to share their ideas and suggestions, and we were tracking everything. We're going to then include that in this report, which will be published in November 2022. And there were just so many great ideas, and it just really goes to show that best practice doesn't necessarily need to be shared by like the biggest voices in the sector. It is anyone and everyone. They know of something that has worked, or that they would like to try and see if it can work, but they just need additional resources. We wanted to ask for as many of those suggestions and ideas as possible. We wanted as many people to get involved as possible. And honestly, those chat groups, so as in the chat functions within the roundtables, have been so great. They've been so, I don't know if busy is the right word. They've been so active that for the rest of the group who are sitting there tracking and not contributing to the roundtables, we're just trying to track everything as quickly as possible, get as many ideas down as possible. And it's been really, really lovely to see. And what we've really liked about our roundtables is that we have made a conscious effort that for everyone, we've tried to include someone who's an expert by experience, so i.e. not just someone who works in social care, but someone who is either using care or is an advocate for someone who uses care. Because if we don't include those voices and those experiences, then we are going to miss out a lot. And there was such great points that were raised by people who were talking about how they're advocating for their daughter who is living in a care home for people who've got learning disabilities, so she's younger than someone who's advocating for themselves, someone who is talking about their experiences of how they joined the sector. It was really lovely to see just like how everyone bounced off each other and all of the great ideas that were generated. And it was really lovely to see the conversation that was being sparked. The panelists talking was then being transferred through to the chat functions as well. So the Voices of Care one is not a round table. It is just a forum, which again is going to be online. So the details are on the IHM website. Sorry, the IHM.org.uk/people plan. I'll send you the links after. And it's just trying to get as many people involved. Bring your ideas, bring your suggestions, bring your experiences. And one of the things we've also tried to but to ask the question is, if you've seen something that works outside of social care, but you feel it could work in social care, let us know about that as well, because we're just going to pull everything together and then we'll publish again in November.
Again, and you know, different things do work for different organisations, different sizes, different kind of types of social care. And I know, you know, as an associate director of RCH care homes, you know, what does the plan mean for you and kind of your care facilities? Because I imagine it kind of impacts that.
Yeah, it's a bit of a two-way process. So what I learned from the people plan, I take to RCH. What I take from RCH, I take to the people plan, and it's very much a two-way process. Um, what we what we at RCH have tried to do is we've tried to implement some of the recommendations. Some of them are still in early stage planning, so they haven't actually been launched out to the wider teams yet. Some of them have been, and what we've tried to do is not only take the suggestions from the people plan, but then put them forward to our teams and ask them for their feedback and then see how can we create a co-produced strategy, whether that's to do with recruitment, retention, some other area. I'd say recruitment and retention are probably the areas that we focused on the most, where we've looked at best practice that's happening in the sector or outside the sector, and then brought it into RCH. One of my favourite things within that is where I mentioned earlier about using your own team stories and experiences. We've created a video series for a recruitment perspective, and it is entirely our team stories and experiences. And my favourite thing about it is that we didn't tell anyone what the questions were going to be. So they were literally put in front of the camera and just asked them to speak from the heart. And they did. And everything they said was just so lovely and heartwarming. And that's great from their experiences perspective. But then from an organisational perspective, we also really wanted to make sure that we focused on that EDI element. So, for example, one of our services isn't a care home. Well, the vast majority of them are, and they focus on residents who we specialise in residents with dementia. One of our services is actually for people who are of working age, young adults mostly, with learning disabilities. And so when we created our videos, we had one video which was just about them and how actually, like we said, social care has this misconception about how it's only for elderly, but in reality, it's for so many more people.
Yeah.
To try to kind of feed it all through.
I love that idea. I think it's, again, for people coming into the sector as well to kind of see people's experiences. And, it goes back to what we were chatting about earlier. The mainstream media is always negative stories, regardless of whether it's social care or not, it's, across the world. But yeah, it's always the negative side. So actually for people to hear the positive side as well, about working within social care is so important. So yeah, I really love that idea, and that sounds like a great change that you've been able to implement. Oh, sorry, go on.
I was going to say, and we've also taken some of the misconceptions that were talked about within the people plan from the public image side, and then asked our teams, what myths and misconceptions did you think about social care before you ever worked in social care, and what do you wish more people knew about it? So the realities of working in social care. And so all of those answers were what helped us build our careers website, our revised recruitment processes from an internal and external perspective. But we really wanted to highlight that social care is for anyone who cares. And so for example, we've got one video which is just talking about, it's just our teams talking about how they've transferred from other sectors into social care and the transferable skills that they've over and why they moved from, for example, catering or hospitality or teaching to social care. And then there's one as well which talks about how social care isn't just women's work. There's again, another misconception that the only people who work in social care are women, but in reality, both men and women do. We wanted to highlight that from our team's perspective.
Yeah, which is great. And, I think it's gone back to the people plan. So what would be your one piece of advice for a care home looking to make a positive change in terms of their people plan?
From an internal perspective, I would say focus on your team. So whether that's your culture, your values, your internal processes, ask your teams what's working, what's not working, what would they like to improve, and then focus on that. Every organisation is different, and that's what makes them all so special. They all have their unique characteristics, their unique personalities, and focus on what works best for you. Don't try and copy someone else just because your competitor's doing it. Do it because it aligns with who you are as an organisation, who your team is, and what your team wants to showcase to the wider world.
Great piece of advice. I love that. I think that's the same, no matter where you are in the world and things like that, I think people do look at other things and go, oh, I should be doing that. Or, why aren't we doing that? But actually you have to look at where you are at that point and concentrate on yourself. So I think that's a really lovely piece of advice. So what's next for the people plan in social care? I know we've mentioned briefly that the 2022 version's sort of ongoing and things like that. So yeah, what's the next stages?
So last year we did a 3-month consultation, and it was a mad dash in the sense of, like I said, a lot of staying up until midnight or 2 a.m. And so this year we're like, right, we're going to be a bit more systematic about it. So this year it's been a 6-month consultation. I've mentioned the roundtables already, and so that was where we were encouraging people to provide suggestions and recommendations for the 5 topics from last year's report. But this year's consultation also includes an additional 5 topics. So that is greener care, EDI, access to care, mental health and wellbeing of people who draw on care, and then regulations and policies. So just to expand on that in a little bit more detail, last year one of the things that we wanted to do was to make sure that we include an EDI recommendation in each of the 5 sections. And then based on the feedback that we got, we realised actually we need to make this an entire section of its own. If we are trying to improve equality, diversity and inclusivity, that can be from any perspective, but what we do need to do is make sure that there is a concentrated focus on just that. And some of the solutions to that are, they can be very simple. So for example, one way to help reduce the gender pay gap is to not ask at interview stage or in the recruitment process how much you were earning prior to in your previous job or in your current job. Instead, you need to be asking what's your market average, or what can you as an organisation afford, and then focus it on that perspective rather than what people were historically on, because as we know, gender pay gaps do exist. And if someone was on a lower salary than one of their male colleagues prior, by asking them what they're on before, you might end up then offering them something lower versus, and it's completely subconscious. Like, people don't do it consciously, but it's a quick fix. It's a cost-effective fix. Just don't ask one particular question in your recruitment process. Sorry, I'm going off on a bit of a tangent, but last year when we focused on retention and wellbeing, the focus was more on the people who work in social care. This year we wanted to make sure there was there was a section which was just about the mental health and wellbeing of people who were drawing on care themselves, and to make sure that the changes that are going forward include their mental health and wellbeing and are as positive as possible. The access to care, it's about the difficulties or the ease in which someone is able to access care. I think a lot of people, they don't start using care or drawing on care until they're at a point where they need it. And so what can be done to make that process as smooth as possible? Regulations and policies, there were so many regulations and updates in the last couple of years. And some of the feedback that we've had is that there's been a very mixed approach between what was being put out at a national level, what was being put out at a local authority level, and see what can be done to make it a more streamlined process. And then greener care is the fact that the NHS has said that they want to be the first healthcare system in the world to get to net zero. So they're very ambitious with they've stated their goal, they know what their ambition is and what they're trying to achieve. They've had a net zero plan for the last 10 years. Social care hasn't had anything. We know that climate crisis is real. We know that it's something that's going to affect everyone, whether you are working in care, drawing on care, whoever you are, it's going to affect you. And I don't think many people realise is that actually social care and the healthcare combined make up 5% of the UK's emissions. And so one of the things that we want to do is to try and, like we said, with last year and with this year, the recommendations that individual organisations can take, as well as systematic change that requires, government support. Let's put it all together. Last year we didn't have a people plan. This year we don't have a green care plan. So why not create our own?
Yeah, you just,
or if not create our own.
It.
If not create our own, why not start the building blocks? Because we have had conversations where people have spoken about how they want to become more environmentally friendly. They want to make their organisation more green, but they just don't know where to start. And that's often the issue. If you don't know where to start, can't take that next step forward. Hopefully this will give them the building blocks and hopefully inspire new ideas and innovations.
Yeah, I absolutely hope so. And I think, like you said, a lot of people they just don't know where to start. So actually having something that, we mentioned earlier, baby steps, it's just making those little bits of a start and then go from there. So where can people find the report if people haven't read it yet, if people haven't heard about it, if they want to go and find that, where can they find the 2021 report, and is there any way that they can get involved in the 2022 one?
100%. So they can find everything, both 2021 and 2022, at www.ihm.org.uk/people plan. Within that, we have got the 2021 reports, the summary, the easy read version, and the full report. We've got the 2022 survey, both like I mentioned earlier, the full survey and the easy read version. We have got different mediums for them to be able to get involved in the consultation. So if you want to drop us a voice note, if you want to send us a message on social media, if you want to get involved in the snapshot surveys that we do, because it's not, as well as the wider survey, we also have snapshot surveys that we run depending on the we have snapshot surveys that we run at different stages over the year about the current issues that need to be addressed. So, for example, last year we had ones which were about the impact of COVID-19 and the vaccines, the burnout rate in managers, and people who are leaving the sector, faster than they've ever left it before. And this year we've got various other snapshot surveys running in the final 2 weeks. So the consultation ends on the 15th of September. You can do the survey. Like I said, you can use any of the other mediums. Just use whatever's easiest for you, really.
Fantastic. So I've got no more formal questions to go through in terms of the people plan, but we mentioned earlier about the what the health tech moments and how we've had some amazing ones of those. It's all about the bit of fun, weird and wonderful stories, heartwarming stories. So what's your what the health tech moment?
I've got so many, it's so hard to narrow them down. So from which ones have impacted me the most? I think this one's going to sound so I've got a few. So there's one where it's going to sound quite silly, but I was watching a Grey's Anatomy episode about, 3-4 years ago, and it was an episode where I found out that women have different symptoms when they're having a heart attack versus men do. And at the time I was just like, oh no, this is just nonsense, but I like to research random things. So I went down a research rabbit hole and found out actually, no, this is a thing where women's fatality rates in heart attacks is higher than of those in men, and it's higher than of other conditions, for example, breast cancer, despite there being fewer women who have heart attacks, because the symptoms are different. So the first couple of ones that they might have often end up going undiagnosed, and then by the time they end up having, a second, third, fourth one, their heart has been damaged so much it ends up being fatal. Whereas men's symptoms are the ones that we're always talked about. We're talking about the shortness of breath, the stabbing pains, or shooting pains in the arm. Whereas women's ones can include that, but it's also things like pain in the abdomen, nausea, dizziness, pain in the jaw, like the jaw neck area. And I was like, okay, wow, this is insane. Like, how have we never talked about this? And from there, I just ended down this huge rabbit hole of all of the inequalities and inequities that happen in women's health. And there's obviously some that I was already aware of, but to realise just how much is either not studied, there's not enough research done about it, there's not enough funding being given to solutions, it just made me want to try and do something about it. So that's where my passion for femtech and health came from. The other one is when I was researching about how we can provide better mental health support to our teams at RCH. One of the things that I found out is that the treatment and the diagnosis and the research that we're often taught about is often based on Western studies or clinical groups, I guess. And so something like depression can show up very different in communities of colour versus their Western counterparts. So, we're taught that depression one of the symptoms of depression can be things like apathy, fatigue. Whereas in South Asian communities, it can often show up as digestive issues, or someone saying, my heart hurts, my head hurts. And it's about making sure that when we do provide support to our teams, we provide that cultural nuance support as best as possible. So those were the kind of the two big ones. And then from an individual perspective, I think one of my favorite ones is this actually happened before I joined RCH, but I heard about it from the team. And we do work, some of our homes, they work with the local nurseries, and they've got intergenerational programs that they are working on. We had one where the nursery children had been coming to that care home for probably about 12 months or so, and we had a resident who was living with dementia, and unfortunately she'd lost a lot of pretty much her entirety of her speech capabilities. And then one day she just turned around and needed a baby, and everyone just burst into tears because they were like, she hasn't said a single word in the 8-10 months that she's been with us, and now suddenly something has, I don't want to say clicked, it's not the right word, but something connected. And after that she did start speaking a little bit more. There were certain words that she was able to vocalize more, and I don't know how to describe it other than it was a really lovely moment. And even though I didn't witness it, it's always one that's stuck in my brain. I think one of the things that people forget about with care providers is that there's so many roles in a care, not just a care home, but like in any care provider. And so even if you're not on the front lines, you still care. You still, whether you're working in the marketing function, the finance functions, the senior team, wherever it is. So many people move and work in social care because they care about the people that they're going to be supporting, and whether that's supporting them from a frontline perspective or not. These stories all still make us smile and get us emotional.
Absolutely. And, even working for, I'm not in a care home or hospital or something like that. It's, we work obviously with a lot of health and social care organisations, and even just listening to our customers tell us stories and that side of things, it's just amazing. And it goes back to that passion side that I think we talked about earlier in the podcast, and making a difference basically, which is just amazing.
Yeah. Exactly. And, when I talk about the people plan and about how we want as many voices as possible, it's not just people who work in a frontline role or people who are receiving care themselves. It's anyone and everyone in the sector. There's so many stakeholders. I mean, there's so many people who've created products or services because their loved one experienced something and they wanted to either amplify that or they wanted to change that for a wider community. And so I think that's kind of the best part of social care, that it is really a community.
Yeah, definitely. Thanks again for joining us this week, Jasmeet, and thank you to everybody for listening. Join us next Thursday for another new episode of What the Health Tech. Don't forget to rate and subscribe wherever you get your podcasts, and if you have any questions for us or our guests, please email whatthehealthtech@radarhealthcare.com.